Hey folks, my name is Mo Amir and this is VANCOLOUR, British Columbia's bona fide culture and politics TV talk show. Tonight, let's talk harm reduction, practices or policies designed to reduce the negative social or physical impacts of certain human behaviors. We tend to associate harm reduction with illegal behaviors like consuming illicit drugs, and Garth Mullins will be here to talk about that in the context of the drug deaths crisis. But we've actually normalized a lot of harm reduction for perfectly legal activities that also have harmful consequences. For example, nicotine patches or nicotine gum is a type of nicotine replacement therapy to help people quit smoking. That's harm reduction. You're not quitting nicotine cold turkey, but you are reducing a lot of the harms from smoking cigarettes. But what about vaping? Is vaping a pathway to quit smoking cigarettes, or does it create a new generation of nicotine users? Here to discuss, the author of the book Vaping, Behind the Smoke and Fears, a Canadian physician and former director of the British Columbia Centre for Disease Control, Dr. Mark Tyndall. Dr. Tyndall, thanks for being here. Thanks for your time.
Great to be here, Mo.
So we know that vaping is addictive. Explain it to me how vaping is actually a form of harm reduction.
Well, if you had to define harm reduction, I think vaping would be the best example you could have. So you have something that people do, smoke cigarettes to get nicotine, and smoking is what causes a lot of damage to their health. And then you put the nicotine in a way, you give it in a way that's far less harmful, and people can still get nicotine, they can still inhale, but it carries I'm trying to come up with a word, it's not safe, but it's almost safe compared to cigarettes.
So what you're saying is vaping is just not as harmful as smoking cigarettes?
Yeah, I mean, the literature would say it's 95% safer, which is hugely safer. So right. I'm cautious to say, it's not perfectly safe, but compared to cigarettes, there's really no comparison. And when I see people smoking cigarettes, I just kind of shake my head and go, well, if you really are needing your nicotine, it's a crazy thing to be doing when you could vape.
Now, I will admit that in my own personal life, I know people who have quit smoking and quit nicotine use by using vaping. Right. And they did that for a transitional period and then were able to actually stop vaping altogether. So they've quit nicotine. Yeah. But with vaping in particular, I feel like it has a slightly different use than nicotine gum or the spray or anything like that, where people are entering nicotine use by starting to vape. So what do you say to that this is actually creating a bunch of new users?
Well, a lot of the focus of vaping has been on youth, so especially high school students. And in 2018, I think, is when it peaked. But in Canada, the survey said, 35% of high school students had tried vaping. But that's really tailed off. There's a fad there that happened, and every year since it's gone down. But like any new thing that comes along, it got a lot of play in social media. It became kind of a cool thing to do and try. And so it became quite popular amongst kids who wouldn't smoke or didn't smoke cigarettes. But that's kind of died down, and there's very few kids that actually continue to use it or are addicted to nicotine through vaping. And the ones that are continue to vape. There's no evidence that it leads to smoking. So that was always a big concern, that these kids would get addicted to nicotine and then start smoking cigarettes. But youth smoking is at historic lows in Canada and North America. So
wasn't it always trending that way anyways, even before vaping was took off?
Yeah. It's not a cool thing to do anymore.
Right.
And so young people don't do it. So that was already happening. And people, still want to experiment with things and try nicotine. And nicotine now has been so vilified, and the actual use of nicotine should be thought of as like caffeine. It's a mild stimulant, and people get some benefit out of it, and some people continue to want to use it. So I don't see any big deal with that. Specifically
to vaping, though, I mean, you have these flavors that are like watermelon Fruit Loops and things that are clearly geared towards kids. So isn't there some harm in trying to entice non-nicotine users who are children into that nicotine usage realm?
Sure, but the media has really used fairly outrageous flavors as examples for kids. And I don't think that belongs in vaping, but 85% of adults who vape choose flavors. So fruit flavors are very popular, mint flavors are very popular, and I don't think you should have gummy bear vaping going on because we're not after 8-year-olds, or people aren't after 8-year-olds. But flavors themselves are very useful and attractive to people who are trying to quit smoking. So to have policies that ban flavors, again, makes no sense. I mean, people associate vaping with flavors, and I think we could, restrict some, outrageous children's flavors, but flavors on the whole are part of the vaping culture.
Isn't there a fair concern, though, that because vaping is relatively new, we don't fully understand the long-term impacts of vaping as we do with cigarette smoke? So there is kind of a gamble in terms of, sure, maybe it's 95% safe now, but we don't know what will happen 10, 15, 20 years down the line.
Well, it really, like vaping was introduced in 2003, so over 20 years ago, and really widespread use has been in the last 10 to 12 years. So millions and millions of people have been vaping for a decade. So and we haven't had any signal that there's any adverse health impact, certainly compared to cigarettes. It's always possible. The longer you follow the trends, you may come up with something, but there's no reason to believe it is based on what people are inhaling. So we know right down to the molecular level how cigarettes cause cancer and heart disease and all these things. And vaping just doesn't have any of those chemicals in it, or at extremely low levels. So there's really no plausible reason that vaping could cause lung cancer, for instance. I mean, it's kind of technically impossible that it could ever do that. So so I don't think we're going to find anything in the future that's surprising.
Really quickly, how many, in terms of the world, like how many smokers exist currently, and what are the possible gains for society as a whole or people's health if those smokers, started vaping instead?
Yeah, I mean, I talk about that in my book. That's why it attracted to me as far as a global phenomenon. I've been in public health for over 30 years, and I've been, in working with harm reduction. But there's nothing that could change the global health status like vaping. If the 1.3 billion smokers decided to vape, I mean, it would be incredible. There's, you could say in Canada, we're already going down. There's about 12 to 13% of Canadians who smoke. So you could say, well, eventually they're going to peter out and not new smokers. But that still leaves 3.5 million Canadians who are going to die of cigarettes. And I don't believe they have to if they turn to alternative nicotine products.
Interesting. Yeah. Dr. Tyndall, thanks so much for your time tonight. I do appreciate it. And good luck with the book launch.
Okay. Thanks, Mo.
Folks, that was Dr. Mark Tyndall. Make sure you look for his book, Vaping, Behind the Smoke and Fears, available at your local bookstore. Now, after some business, as the toxic drug crisis enters its 10th year as a public health emergency in British Columbia, have we really reduced the harms of the toxic drug supply? We'll talk about it up next.